Hi, my name is Mariah. I'm a medical assistant here at Allure Medical. I'm going to demonstrate the medical assistant portion of an RF or radio frequency ablation. So when I first enter the room, I always introduce myself to the patient and ask how they're feeling. Hi Shauna, my name is Mariah. I'm going to be your medical assistant today. How are you?
Great.
Good. Good. How are your legs feeling today?
A little achy.
Okay. Any other symptoms going on?
Swelling, restless leg.
Okay. Have those been occurring or are they new symptoms?
They've been occurring.
Okay.
Probably the last 2 years.
Okay. Are they in certain areas on your legs? Any specific areas?
Swelling probably on both legs from the knees down, and restless legs, both legs. Achiness when I'm on them for a long time.
Okay. Any chest pain, shortness of breath, fever, nausea?
None.
Okay. All right. Before I make contact with the patient, I always wash my hands first. Okay, Shauna, have you had any medical changes or changes in medication since we saw you last?
Nope.
Okay. Any changes in allergies?
No.
All right. I'm going to go ahead and take the patient's vitals. So I'm going to slide this on her arm. Make sure that the patient's feet are both on the floor uncrossed. And then I always elevate the arm as well. It's important that the patient doesn't talk while we're taking the blood pressure either. Okay, and then I always let the patient know what their vitals were. So her blood pressure was 120/82 and her pulse rate was 67. And I'm gonna go ahead and take her temperature as well. The thermometer just goes in the ear, it beeps when it's ready. Okay, and your temperature is 98.3. So next step is to go ahead and get the patient draped and ready. All right, so we're gonna start the draping process here. You always put your gloves on first. And I have everything already set up in the room here. So the first thing you do is you take the sock off the foot that you're treating, and you just replace it with a new one. So we're gonna take this sock off and just toss it in your laundry bin. I don't know, we're gonna put another sock on. This is a clean sock that just has not touched the floor. And then we proceed by putting a towel under the shorts and under the undergarments just to hold the shorts out of the way for the ultrasound. So we're gonna slide that under there and fold it over and make sure the shorts are pulled back, kind of exposing the groin area. Then we're gonna get our sponge. We wet the sponge first, and then we'll wash the leg and place the drapes. All right, so I'm gonna ask the patient to raise their leg for me. And you always start scrubbing in the area that we're gonna be treating and work your way in a circular motion outward. So we know we're gonna be treating probably in this area, so we're gonna start here and work our way around the leg. Make sure you get all the way up into the groin area. And we go all the way down and around the leg. I'm gonna set my sponge aside and I'm gonna ask the patient to hold their leg up for a second. And we're gonna spread the drape across. You can touch an inch of the edge of the drape to open it. I guess I should. Okay. Okay, make sure it's tucked under. Go ahead and rest your leg. It's also important to make sure that the drape is covering the opposite foot or on the leg that we're not treating, so that that foot isn't hanging out, so it's a sterile field. And we're also going to put a drape across the torso. Open this one up. And we're going to tuck the drape into the shorts. Be careful to try and not touch the leg. Again, touching only an inch of the edge. We also have a wedge pillow that we're going to slide under the patient's leg. So I'm going to ask the patient to pick their leg up again for me. And I slide it under all of the drapes and the sheet. And then we ask the patient to rest their leg on the wedge with their knee bent and folded outward, kind of like a frog. Okay, so next you attach the tubing for our tumescent to the drape, the top drape here. So we just kind of pinch it a little and attach it, and then leave it sitting over to the side. You just don't want it to be touching the leg at all. Our draping process is now complete. So you just step out, let your director know that you're ready for your ultrasound tech and provider. Okay, and then we need to close the provider's gown for them. So you just Velcro the top and then tie the back like that.
I'm Katie. I'm one of the ultrasound techs. I'm going to be showing the tech portion for the radiofrequency ablation training videos. So my hands are already washed and ready to go. I take my gown sleeve, which is sterile, but we do a clean procedure, not necessarily a sterile procedure. I take it out of its packaging, just unfold it, I slide it on. I use my right arm. You can use whatever arm you choose to have protected. Then I take my gloves and pull them over the gown sleeve just to protect from anything getting inside. And then I grab my ultrasound probe and a clean towel. Open up the towel, and then I have the Dynahex, which is our sterile solution to clean. I scrub my probe. Make sure that you don't have any excess amount of cleaner still on the probe. It will cause bubbles, which will then leave a dropout in your image. So then I'm ready for the medical assistant to drop the sterile gel.
Okay, so you're gonna feel a little warm gel on your leg here.
So the medical assistant drops the sterile gel onto the leg, and I then just spread the gel out. And I start scanning proximally, finding my greater saphenous vein, and I follow it down, looking at size, looking at branches, trying to find an access point. And her greater saphenous splits distal below the knee, so I'm going to go above the knee. And right here looks like a great spot. I don't see any nerves in the area.
So we want to connect our provider's sterile tubing to the tumescent tubing that we attached to the drape earlier.
And so what I do is I have the vein that we're going to access in the center of the screen in a transverse plane.
It's important for the medical assistant to let the patient know what they're going to be feeling and when. So I'll let her know that she's going to feel a little pinch, maybe a little burn right here.
1, 2, 3.
It's also important for the medical assistant to communicate with the patient and ask them how they're doing throughout the procedure as well. So Shauna, how you doing?
I'm doing great, thank you.
Good.
We will use a 7 access kit, please.
The tech and provider let the medical assistant know what size access kit they're going to use. In this case, they decided they were going to use a 7, so I'm going to go ahead and drop it on the tray. This has a lot of components in it, so it's important to drop it carefully because they tend to fall out and jump around, and you don't want them to fall on the floor.
So holding still after the provider has already done the skin wheel, the provider starts the access.
You might feel a little pressure here. Flash. So the medical assistant lets the provider know when they see a flash in the hub of the needle. That way the provider can have their eyes on the screen at all times.
The provider is now inserting the wire, which holds the vein open for when we slide the sheath over in place. Should have used a greenie.
Yeah.
you're in. After it's confirmed that the wire is in and the provider says to do so, the tech then scans proximally, following the vein with the wire in it, assuring that the wire stays in the vein and does not go into any other vessels.
Okay, Shauna, you're gonna feel a little bit of tightness and pressure.
Then the tech comes down to the access point and goes along to get the wire in, so the provider has a clear image of the wire as she's adding tumescent on top of the wire.
Still doing okay, Shauna?
I'm doing great, thank you.
And then I'm going to move away from the access point because the provider is going to make a small incision with the scalpel to allow room to advance the sheath into the skin and into the vein.
I feel some pressure here.
You can assist the provider by holding up the thigh or squeezing the calf. Helps guide the sheath in. And then we will use 100, please. This is the 100-centimeter ablation catheter.
And the medical assistant opens it, and it's important to make sure that the inside of it stays sterile. So I hold the bottom of the tray here so that the provider can remove the catheter. And you set the tray aside and grab the cord from the provider, stretch it out, and plug it into the RF machine.
So now I scan the greater saphenous following it proximal to the saphenal-femoral junction, and I'm going to go into long,
Might feel some pressure here, Shauna.
and I'm going to have this saphenal-femoral junction to the left of my screen, and then we will see the catheter advance. It's right here. And the catheter is just a little stuck, so we're going to lift up on the thigh,
There we go.
get it to advance. So now I get the junction into the left side of the screen. And then I'm going to look, the catheter is going to need to come back. It's perfect. And that's about 2.5 centimeters away from the junction. So now that the catheter is in place, I'm going to tilt the patient's feet up. And I'm going to lower the table so the provider is able to reach when she's tumescing. So now I go to the tip of my catheter and I get it into view, and the provider will start adding the tumescent to surround the catheter with the numbing fluid.
Okay, Shauna, you're gonna feel another pinch.
Provider makes a skin wheel. She will then use the larger needle to add the tumescent.
You might feel some pressure and tightness here.
So what I'm doing is just adjusting my probe, giving the provider the image of the catheter. Looks good. So once that area is adequately tumesced, we move down about a probe length and a half. Going to go in long again,
Shauna, you're gonna feel another pinch here.
focusing again on the catheter. We're going to repeat these steps till the entire segment of the vein is adequately
A little
tumesced.
more pressure and tightness.
Scan proximally just to make sure that this area that we're tumescing meets the last area. You can see the separation of the fascia, maybe just a little bit more below. Perfect.
Still doing okay, Shauna?
Doing great.
And then in short access, I scan down again, a probe length and a half or so, 2 probe lengths, and
feel
go into
another
long.
pinch.
I'm keeping the tail of my probe up, assuring that I am perpendicular to the vessel.
A little more pressure here.
I'm sorry, that I'm parallel to the vessel. That provides the sharpest image of the catheter. And now I scan the entire length of the vessel in short. I'm looking at the amount of tumescent around the vessel, making sure that there is enough. And it looks great. So I'm going to scan proximal. I'm going to double check that the tip of the catheter has not moved. So I look at my junction and then I scan distal to where the tip of the catheter is, and it has not moved. So now that we're all tumesced and we're ready to start the laser or the radio frequency, I apply pressure with my probe. And go ahead. So we apply pressure to the proximal segment only. Let us know if you feel anything hot. Still doing okay?
Doing great.
Perfect. We'll be done in about a minute. Each treatment segment is a 7 centimeter segment that is treated, and the RF ablates for 20 seconds at a time at each segment. So at this point, I'm just looking with the ultrasound, looking at the vein. It isn't necessary to follow the radio frequency as it's being run. But I do keep the ultrasound handy just in case more tumescent needs to be added.
About 20 seconds left.
Almost there. At this point, the tech is finished. I'm going to take my ultrasound probe. I'm going to use the extra cleanser that was on the towel to wipe my probe off.
The medical assistant takes the catheter from the provider. I always have a cannula in hand to wipe the catheter off with.
I'm going to grab a Sono wipe and wipe my probe with a Sono wipe.
My open. That's a little bit pressure.
The provider just adds a little bit of tumescent to the access site. It helps stop any bleeding that might occur.
And I put the probe back in the probe holder. Then I'm also going to take this towel and use it just to wipe down the patient's leg.
After the medical assistant wipes down the catheter fiber, we remove it, but before removing it from the machine, it's important to make sure you read your data, because as soon as you unplug it, your data will be gone. So So we did 5 cycles.
Thank you. So I removed my gown sleeve and my gloves and already discarded them in the trash, and now I'm just going to wash my hands with soap and water and dry them off, and the tech portion for the radio frequency is all finished.
All right, so after the procedure, it's the medical assistant's responsibility to get the patient ready to go. After I took the catheter and set it aside, I set a cavi wipe and some wipes on the drapes here. I'm going to take my cavi wipe and remove the tumescent. So I'm going to take the sterile tubing off. We want to make sure we wipe it down really good, along with the hemostats. Okay, and then we're just going to set it back over here on our IV stand. Okay, and then we're going to collect all this stuff off of the drape. And I usually set it on my tray that's still sitting over here. Sometimes the providers remove the sharps and throw them out on their way out. Courtney usually does that, so she already did. Sometimes they are still there, so always make sure to check your tray before you touch it, and make sure to put the sharps in the sharps container if there are still some on the tray. So we're gonna come over here. I like to remove the wedge from under the patient's leg, so I'm gonna have you just lift your leg slightly. Thank you. Set the wedge aside. It needs to be cleaned after. Then we take our wipes, and we're just gonna make sure the leg is nice and clean, that there's no blood dripping here or anything. Wipe the leg down. Okay, and then we're gonna remove the drape from under the leg. You can go ahead and rest your leg. Just roll the drape up. You can remove the drape from over her torso as well. Roll that up. Then you can set it aside. Now we need to dress the leg for the patient to go home. So we're going to put a Band-Aid over the access site, a pad along the inside of the area that we treated, in this case it's her thigh, and we use an ACE wrap or the compression stock to hold that pad in place. So I'm gonna grab those and put them on. Okay, so I'm gonna take the towel out from under the patient's shorts here. Sometimes I fold it over and use it to dry the leg a little if it's a little wet. Make sure the area where you're placing the Band-Aid is clean and dry. Place the Band-Aid over the access site. Okay. Hard to open sometimes. There we go. Okay, so now we're going to place the pad along the area that we treated. So along this area here. And I like to have the patient bend at the knee a little, but rest their heel on the bed. Then we're going to wrap the leg with this ACE wrap to hold the pad in place. The pad's purpose is to collect any of the numbing fluid that might leak out of the leg. Most of it gets absorbed by the patient's body, but some of it can leak out, so we don't want it to get on their clothes or anything. And we usually recommend that the patient wear it for around 12 hours. Then they can remove it and take a shower, and everything is normal after. Here we go. You can go ahead and relax and straighten the leg if you'd like. After dressing the patient's leg, they can go ahead and get dressed. You always need to make sure that you set up their next appointment. So I always ask the patient if when they'd like to come in again. So Shauna, you're gonna
Same time?
next week, same time? Okay. So she's gonna need a post-op scan or a post-laser scan. So that will be her next appointment following her lasers. And then the appointment after that would be for ultrasound guided injections. So we'll go ahead and set up her next appointment for her next week while she's changing. And then we'll walk the patient out.